Welcome back. We're going to take the time now and focus on some health news this morning. And of course, our attention always on COVID-19 these days. And this morning, we're going to look at obesity and how our weight can have an impact on that. This morning, I'm very happy to welcome Dr. Murr from AdventHealth this morning, who's going to talk about what a struggle this is, I think, for a lot of people, that you don't need to be embarrassed about this, but it is very, very important that we talk about it and that we find solutions that can help. Dr. Murr, so good to see you. Thank you for joining us.
Great to be with you, Carly.
So as always, when we talk about COVID-19 and this pandemic that we're in the middle of, the news changes very fast. I feel like we still are trying to get a handle on, this pandemic and what works best. But it does seem that obesity and weight that really hasn't changed, that is a factor in our health.
Absolutely, yeah. People with obesity have many other serious medical conditions, such as diabetes, hypertension, sleep apnea. And those conditions by themselves put a lot of stress on the body and body systems and tax the body's reserve. So when it's understandable when something like coronavirus infection, which overwhelms the body reserves, people with these conditions, it's probably very difficult for them to overcome these infections.
It's interesting. I think a lot of people have been talking about weight and trying to maybe embark on that weight loss journey. It is not easy, though. And as we were talking about before we got started, if it was easy, we wouldn't be here in the first place. If someone really is ready to take steps and start this weight loss journey, what advice do you have for them, doctor?
The best advice is start with few simple things like manage foods better. Let's walk away from sugary drinks, foods that are rich in carbohydrates and fat, and pick up more proteins that are present in chicken, turkey, and fish. And at the same time, do a little bit more with physical activity. So you just need a little bit of increased physical activity every day. 25 minutes of moderate exercise. It could be walking in the neighborhood, walking the dog, or getting on a bike. Simple things like this would help reduce the amount of calories we take and would help us spend the calories that we have. And sometimes, like we were talking about, it's not easy, especially in patients with obesity who are on the upper end of the spectrum of weight. For those patients, we talk to them about bariatric surgery.
So talk about that. What are your options there? Who's a good candidate? Tell me a little bit about what you and your team are able to do.
Well, bariatric surgery has been our focus for 20 years now, and these operations are designed to make the stomach smaller and divert some of the food away from the stomach. These operations work by limiting the amount of food we can take, but also it changes certain digestive hormones that changes the way our body utilizes calories and changes its body composition. They're very effective in inducing weight loss to the point where food management and physical activity would become sustainable measures for weight loss for a long time. When we're thinking about bariatric surgery, we talk to patients whose BMI, their body mass index, is about 35 or higher, which is approximately about 75 to 80 pounds overweight.
Well, and what's interesting, I'm just assuming that would help, because we were talking before we got started that sometimes when you're overweight, it's not as easy to just go take a walk. I mean, it literally is painful, I think, for people in their joints. I mean, is this a way to just help that process along to help with that healthier lifestyle in the future?
Absolutely. So the surgery is a gateway into a healthy lifestyle. When somebody's weight is up here, physiologically, it's impossible to lose weight by just dieting and walking or exercising. You have to disrupt that body weight regulation down to here, where food management and physical activity become effective. And the best way we could do this more effectively and safely than anything else is with bariatric surgery.
All right. Well, where can people find out more information? Again, I think this is going to pique a lot of people's interest, because this is, I think, what a lot of the health news has been sent around as well. What would you have them do? What's your take home, doctor?
Well, let's get you better, and for a better quality of life and healthier quality of life, call us at AdventHealth. We're happy to see you. Bariatric surgery is one of the safest abdominal operation nowadays. We've perfected doing it through minimally invasive techniques that lessens the body trauma, lowers pain, and enhances recovery and getting back to daily activities.
Well,
In many ways, we are the expert who treat you as a whole.
All right. Well said. I was going to say, pandemic or not, we all know that the benefits of being at a healthy weight and whatever the disease or anything we're trying to prevent is certainly going to help. Doctor, thank you so much. We appreciate your time this morning. We'll make sure all of that goes on our website too.
Thank you, Carly.